I'm Dr. Pri, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. Which cardiac imaging option should you choose? So here on the screen, I'm showing you a coronary calcium score. That's the one that a lot of folks have heard about, but there's also another one that is potentially better. It definitely gives you better data, but there are real trade-offs here. So we're going to talk through that. There are really two main imaging tests, this coronary calcium score and something called a coronary CT angiogram. They are different in what they are testing for, how they test, how invasive this is, the cost, and how easy it is to find one of these tests. So there are some real nuanced differences here. However, that coronary CT angiogram is the better test. That is 100% for sure. Both of these tests use CT technology, computed tomography. This is kind of like a 3D X-ray. That's the best way to think about that. And both of them do require a doctor's prescription, although some places are streamlining this. So you all heard me talk about Function Health before. Function Health allows you to get a coronary calcium score. It's pretty low risk, so they have a doctor on their back end, essentially, that will go ahead and order it for you. So that is a great option. For both of these tests, in addition to requiring a doctor's prescription, one of the things they'll ask you to do is not have caffeine for 12 hours beforehand. And one thing you should always think about when you're getting imaging done, especially x-rays, is radiation. They both generate 1 millisievert of radiation, which is roughly a third of the radiation you get just by living at the sea level specifically. If you live higher up, you're going to need a little bit more radiation because there's less atmosphere to absorb that. Now, we're going to talk through the differences between these two and which one you should pick. Let's start with the coronary calcium score, as shown here on the screen. So this is a great image, the Australian Journal of General Practice, really great information here. So they show you two different coronary calcium scores up here on the screen. The one on the left has no calcium. You don't see anything light up there. The one on the right has calcium within one of the arteries in the heart. That's really what we're looking for. And I spoke about this in another video. I want you to recall the process. What's happening is in the arteries of your heart, which are supplying oxygen to the muscles in your heart, you are getting this plaque buildup in the side of those arteries. That's cholesterol, there's inflammation that goes into it. I go into detail on this in another video. However, when this starts happening, your body can start trying to protect you from what you really don't want to happen, which is at the bottom, which is this plaque rupture. And what happens there is that some of the plaque actually gets out from the lining of the artery wall and gets into the middle of the artery where all the blood is flowing, and a clot forms and just fills up that space. That's how you get a heart attack. So your body, if you look here, I'm going to try to zoom in. You see these little blue dots they have here? They're indicating that these microcalcifications are occurring. And if you can get enough of those calcifications, it stabilizes that plaque, prevents that rupturing. That is really the main goal here that your body's trying to do. And as indicated on here, the CT scan can see that. X-ray, CT scans, they pick up bone really, really well. There's calcium in bones. So these types of elements are picked up well on this type of imaging. Also shown here is that this calcium score, it goes from 0 to, well, it doesn't show you the top, but it goes from 0 to 1,000. That indicates your risk of having any kind of heart attack or stroke in the next 10 years. And if it's 0, it's less than 1%. Keep that in mind. A calcium score of 0, meaning they saw nothing, doesn't mean you have a 0% risk. And that, again, is because you might still have some of this plaque that is not calcified, or the calcifications are so small that they can't pick it up on the CT scan, and therefore it could still rupture. What else do we need to know about a coronary calcium score? It is a non-invasive test. Like I said, 5 minutes. You literally show up, sit in the scanner, you're done. Low dose of radiation. The costs are about $100 to $150 in the US, and they are very widely available because they are considered so cheap. So that's option one. At the end, I'll tell you how you think about which one you should get. Oh, and here's some more information on the scoring. I'll include this in the show notes. Option two is called a coronary CT angiogram. This is a document that I share with my patients here. But this image is really instructive. And what happens in this test is the goal is to see the inside of the blood vessels, not just the outside where it's calcified, but to be able to tell what's going on. How much of this do you have where the lumen, as they call it, or the inside of that blood vessel is no longer fully open? How much has it closed off? That's what we're looking for with a coronary CT angiogram. What it does is it then reveals the early plaque, the early risk. And sometimes some of these are not even early. They're actually really filled up, but they haven't calcified, which you cannot see if it's not calcified on that coronary calcium score. And in these tests, what they'll do is rather than give you an overall score, they'll go through each of the major arteries in your heart and tell you how much those are narrowed. And here's an example of a report that somebody shared on Reddit. And what you can see here is it says territory, that's the artery, and RCA, LM plus LAD. These are, RCA is the right side of the heart, LM and LAD are the left side of the heart. Circumflex kind of goes around it, and it gives them a plaque volume as well as a percent atheroma volume here. So it's actually not showing it on this. Oh, here we go. And at the bottom, stenosis, which means narrowing. Severe means greater than 70 or 50 to 70% narrowed if they had this anywhere. And for this person in their left side here, they had a 28% narrowing in one of the branches on the left side of their heart. A little complicated, but point is you can see where your weakest area is and therefore decide how you want to manage your heart. This is where we think a lot about cholesterol and we start thinking about other ways to reduce your risk. But this is the gold standard right here because you're literally getting a view into what's happening in your arteries. This test is more invasive. The coronary CT angiogram. It requires you to get IV iodine. Remember, those heavy metals show up well in these CT scans. So we got to put some heavy metal inside your blood. There used to be a little bit of a risk of having some kidney damage that was typically reversible with iodine-based contrast agents. That has now gone away. They've moved to different types of contrast agents that don't have that risk, still iodine-based, but they've modified them. But you will need an IV. You will have to get that contrast, and they need to make sure your heart is not beating too quickly so that they can actually capture those images. So they might give you a one-time dose of a medication called a beta blocker, typically one called metoprolol, and that lowers your heart rate below 60 when you take this test. Because it's more invasive, it costs a little bit more. It's usually $600 to $800 out of pocket. However, it's also more commonly covered by insurance, especially if you're having some chest pain. It's a little bit less widely available because it's invasive. It's not so easy plug and play, but any hospital and a lot of cardiology clinics will do this. So it's still not very difficult to find. All right, so we've talked through those two options here. I'm just going to show you my document here. So talking through these two options, which one should you choose? Well, if you want the best data, go with this coronary CT angiogram. You're going to see everything, and that's what a lot of my patients opt for. If you have a really high risk of heart disease from family history or high cholesterol, maybe you're older, then also this coronary CT angiogram makes more sense. But if you have a low risk of heart disease and you're really just trying to see that score of 0 to make sure everything's okay, then the coronary calcium score makes a lot of sense. It's a screening test, really. Or if you're cost sensitive, $600 to $800 out of pocket is too much, then that coronary calcium score also makes a lot more sense. So I hope that's helpful, gives you an overview of how you can get some of this gold standard testing that is really unambiguous as to what is going on with your body and your heart.